Welcome to Mount Sinai Live. We stream smart healthcare information that's simple to understand so you can improve your health. I'm physical therapist Dr. Jimmy McKay, and I'm your host. Today, we're learning more about geriatric mental health. Over the past 2 years, the pandemic has changed our way of life, and we've had to adapt to a series of ever-changing, unusual, and difficult circumstances. While many New Yorkers are experiencing relief as we begin to reopen and adapt to a new normal, it's important to check in on your mental health. To help us with that, let's bring in the Vice Chair and Chief of Geriatric Psychiatry for Mount Sinai Beth Israel. Welcome to Mount Sinai Live, Dr. Melinda Lantz. Dr. Lantz, welcome to Mount Sinai Live.
Oh, thank you so much. It's wonderful to be here. I really appreciate it.
Excellent. Dr. Lantz, as we all slowly begin to reemerge into this post-pandemic world, older adults may encounter unexpected challenges and changes. How can we adjust to this new normal and reconnect in order to move forward?
Oh, it's really important to create a new normal for ourselves, which means looking around. What is important to us? What would we like to regain after the pandemic? What does our neighborhood look like? Who are the people in our lives that we need to reconnect with? So many of us will find that establishing a new normal is relatively simple. A lot of others will have to define, where they live, who's in their neighborhood, who they have to reach out to. So creating a new normal is very important, and creating a comfort zone for ourselves is very important.
Great advice. What are some things that older adults can do to enhance their well-being? Can you give us a few things to focus on to encourage a return to normal?
Sure. We hear this a lot. Doctors give this advice all a lot, but taking care of ourselves is really the most important thing. So making sure that we're eating well, making sure that we're getting enough sleep, making sure that we are paying attention to self-care, making sure that we are going back and seeing doctors for wellness visits, and also to catch up on prevention that we may have missed. But it's also very important to connect socially. Social connections are by far the most important feature of successful and healthy aging. And it's actually quite important to people of any age. So reaching out to friends and relatives and reestablishing those social connections, hopefully now in person, that we could only do by telephone or video over the pandemic.
So let's look for signs. What are some typical signs that would indicate that an older adult may need to reach out for help? What should we look for?
Sure. Many older adults did very well during the pandemic. However, some key signs to think about that you really do need help above and beyond your own self-care are really feeling that you're paralyzed and can't get up, can't get out of bed, can't leave your apartment. A lot of people are now very, very fearful and very anxious about leaving the indoors to go back outside. And if you can't do that because you get too anxious or overwhelmed, that's by far the most important sign that even just a little bit of support and help can help you. People who have stopped any social activity and social connections, people who have sort of given up on reaching out to others in their surroundings, that's very serious. And that's probably the biggest warning sign and the biggest sign that you should really get some help for yourself.
Excellent. Great insight. During the pandemic, a lot of things went virtual, for better or for worse. I think one of those things were the adoption of virtual support groups. Talk to us about virtual support groups that may help older adults get back on track.
Virtual support groups have been amazing. Senior centers have been running them. Programs for older adults have been running them. A New York Project Hope, the agencies that provides COVID support, has been running them and still runs them. And one of the key features about those is that they provided help during the pandemic. And now those same groups are helping people transition from virtual to back face-to-face when they can. So those groups can not only help you in your apartment, they can help you transition from going back outside and socializing in the outside world again.
From your point of view, do you find more adults, maybe people 15 older, are actually actively seeking out help from a mental health professional as a result of the pandemic?
Yes, to some degree, and it's been very helpful because many, many people over the age of 50, 60, 70s, even in their 80s, can do very well with brief supportive contacts and brief supportive therapies. And it's a good example of a little help can go a very long way.
Coping strategies is definitely a tool that's suggested. Can you suggest a couple coping strategies that older adults might employ to get through tough times?
Yes, creating a new daily routine for yourself is very important. During the pandemic, time was not such an issue, and a lot of people's routines kind of fell apart. They didn't go outside. What time they ate or what time they went to bed didn't matter as much. But now things are opening back up. The weather's getting better. This is a perfect time to get a new routine for yourself that incorporates the inside world and the outside world. So your own personal routine is very, very important. And I can't stress enough that new routine should include some social connectivity. Who in your life is important to you? Who have you lost contact with? Who do you want to maintain contact with? Who can you socialize with in your own neighborhood? Getting to know your own neighborhood again. So incorporating a routine that's healthy for yourself that includes sleep and exercise, as well as social connections.
The idea of emotional reserves, something we can store up. How can an older adult replenish their emotional reserves?
One thing we know about older adults are incredibly resilient. Older adults have a lot of life experience. They've dealt with a lot of adversity. They've had a lot of events in their life that they have successfully coped with, and they are able to use those skills. Right? That's wisdom. Right? Older adults have wisdom, and that has helped older adults tremendously through the pandemic because they had coping skills that they used throughout their life. They lived through a lot. So emotional reserves is being able to draw back on your wisdom, make choices that are sound for you, set boundaries with yourself so that you're not overextending yourself, but at the same time, reaching out to people who you can help and you can get help from.
That's great insight. Dr. Lantz, thanks so much for the knowledge and the wisdom. Find us at Mount Sinai NYC on all major social platforms. This has been Mount Sinai Live. We stream smart healthcare information that's simple to understand so New Yorkers can improve their health. I'm physical therapist Dr. Jimmy McKay. Thanks for watching.